Did you know that 1 in 7 babies in the UK will need some neonatal support? And NICU isn't just for premature babies. 60% are full term. Despite this, NICU isn't really discussed at all or at any length in antenatal education. When our hopes for a healthy home birth didn't go to plan, and our full-term baby was admitted to NICU with meconium aspiration syndrome, we had absolutely no idea what to expect. We were totally shocked. We had no idea how anything worked, and most importantly, we didn't know how to feel empowered as parents despite our baby being really ill. So in this video, I'm going to share what I wish I'd known about NICU and hopefully help parents in a similar situation to feel more empowered and to know what they can do straight away to still care for their baby and to help their baby feel better until they're ready to come home. I'm also trying to encourage and inspire antenatal teachers to prioritise talking about NICU in their discussions with birthing families during pregnancy, so that people can be a bit more prepared, a bit more informed, and then hopefully a lot more empowered when it comes to their babies not being very well. I've actually made some handouts to help antenatal teachers to have these conversations and to give birthing families as a reference. And I've decided I'm going to make them free to download and share because I really want to just get the word out. A lot of the trauma that I still carry about NICU is knowing that we didn't know we could do certain things straight away, and we weren't given that message that we were still in charge, that we could ask to do things. Like we weren't told until a few days in that she probably wouldn't like the way we were stroking her so softly. I wasn't told until a few days in that I could be using the colostrum I'd expressed antenatally to do mouth and eye care. I wasn't told straight away that we could bring in our own blankets for her nest. I wasn't told that I could wash her. We didn't know. We didn't know if what we could do. We were so shocked. And it's things like that that I look back on and think, I wish I'd known that I could have taken charge. And it wasn't until 3 days in that a doctor said that would commit to saying that she was going to survive. And the first doctor we had, English wasn't his first language. He wasn't a very sensitive communicator, and he will always wonder, did we need to spend those 3 days not knowing if she'd make it, if we just asked to speak to another doctor? I also feel if our antenatal classes, our doula sessions, or our hypnobirthing classes had talked about the potential for NICU before birth, then maybe I could have gone into it having an idea of how I could still feel empowered and like I was doing everything that I could for her, even though I couldn't hold her or feed her or make her better. So here are the things that I wish I'd known. You are still the parent. You are in charge. In a scary situation, it can be hard to remember, but it's so important to know that parents are not visitors. They're partners alongside the doctors and nurses that are looking after your baby. You're still the decision maker, even though your baby needs medical support. And you can ask for another doctor or a second opinion if you feel like you're not being heard, or you don't quite understand them. Make sure that when the doctor comes round, you make notes. Don't worry about being a bother. Ask the same questions over and over again if you need to. And you can use brain, benefits, risks, alternatives, instinct, and nothing to know that you're making empowered, informed decisions for your baby. And also know that you can call anytime you want an update on your baby and ask specific questions, otherwise you'll just get, oh, they're fine. And always trust your instincts if you feel like something isn't right. You are the expert on your child. Your baby needs you more than they need the doctors. You can make a difference to your baby's experience. Something that really mattered to me was knowing that there are things I could do to help make it easier for them, more comfortable, help them to feel safer. And I wish I'd known these things straight away, not 3 days in. So there's ways that you can reduce the stress and the overstimulation of the NICU environment for baby. Even if you can't hold them, you could still place still, restful hands at their head and their feet to help them feel contained, like in the womb. Babies expect to be held, don't they? So if we can't hold them, we can contain them, and the nest that they build for them helps too. So having still, resting hands is thought to be more soothing to baby than soft strokey movements, which might contribute to their overstimulation. You can minimize overstimulation from the noise and the lights and smells in other ways and improve their environment, like partially covering the incubator with a blanket. You can make sure that baby has time to recover after tiring or stressful procedures. You can make sure your hands are warm and speak before you touch your baby so that they're not startled. Let them know you're coming. Don't wear perfume or deodorant so that your baby can smell you, because your smell and your voice are everything they know about the world, and it will help them to feel safer. Talk and read and sing to your baby as much as you can. Your voice is everything. You can provide comfort with breastfeeding if you can, or skin to skin during procedures if possible. And you can ask to do those things. Don't wait to be offered. You can ask. It's okay. You can also bring in your own things to put in their incubator, and this wasn't offered to us, and it's little things like that I think it would have helped me feel more empowered and in control. So bring in your own nappies if you've got your own you want to use. They put little gloves on her because her nails were scratchy, and they put a hat on her. Bring your own hat and your own gloves, and we put a little teddy in there, and I put a bow on her one day just because I wanted to feel like I could do stuff with my baby. So personalise your baby's sleeping space. As long as you're not bringing anything in that's dirty, like it's your baby. You decorate her area. You bring her blankets and the cloths and stuff. She can have her own things. You can help to provide comfort to your baby when you have to go. If you get a soft toy or a muslin cloth and keep it against your skin, and then you can put that in the incubator when you have to leave them and they can smell you. You can feel more empowered by taking the lead with your baby's care. So don't wait to be offered to do things for your baby. We did, and I regret it. She smelt funny for days, and it was days in before I said, have you got something, is it all right if I wash her? And now I realise I could have done that straight away. I was just so shocked and disempowered. I didn't even think to just clean her head. Don't wait for the nurses to offer things. Ask. If it's not safe to do so, then they'll tell you. But now, my husband and I look back and we think, if we'd asked, could we have done those things right from day one? So if you can take charge of your baby's care and be proactive and pushy if you need to be, ask for support so you can have as much skin to skin as possible. It's going to help your baby get better quicker. The more skin to skin you have, the sooner they'll come home. And you ask for support to give kangaroo care, and in a sling or a wrap. Nobody offered that to us, and I don't see any reason why we couldn't have done that. Get support to understand your baby's condition and their needs and their medications and their treatment, so that you don't feel like a bystander, because you're not. You're the expert on your baby. You can ask them to help you to change the nappies yourself, to change the bedding yourself, to remake the nest that helps the baby feel contained. Get them to show you how to do it, so that whenever you're there, you're looking after the baby. You can get them to show you how to give mouth and eye care with your colostrum and your breast milk, and you can get them to give you the support to express your breast milk regularly so you can establish breastfeeding. For me, that was hugely important because birth didn't go how I wanted it, and so I was even more determined to breastfeed than I was before. There was absolutely no way I was not going to get breastfeeding in when the birth went so badly. So make sure you keep pushing for the support. I had to push and push. And we made it. After 2 months of shields and a tongue-tie division, I breastfed her until she was 3. And I urge you to push for the support you need to make that work, so that you've got that win. You can also manage the tube feeding process. You can ask to do that, and you can also say to them, could you wait until I'm there to do procedures, if possible, unless it's an emergency. So, and if you don't say, they won't know. They might not know that you want to be there when they do procedures. So they might do something while you've gone to get some lunch, or, gone to get examined or something. But if you say, can you wait until I'm back, then you won't have to worry that things are going to happen to the baby while you're not there. So I'd really like to help raise awareness of NICU, to try and lessen other people's trauma. I really think if we'd gone into it having an inkling of what it might be like, then we could have been more empowered, and then that wouldn't be an element of my trauma. So I really recommend this book for more information about how to do the caring for your baby when you're in NICU. I'll put the Amazon link in the description. You can also download a free PDF booklet from the same authors called with First Steps for Parents in the Neonatal Unit, that would be good for people to read straight away. I'm really proud of the fact that the trauma of our birth didn't dent my passion for physiological birth, and I actually started to make pregnancy and birth art during my second pregnancy, which led to making birth education downloads for birth workers to use with families. And I've made some NICU handouts which birth workers can download to use as teaching tools or give as handouts to birthing families. And I've decided to make these free because I just really want people to get support. So birth workers can download these for free if they would like to share with people. I'll put the link in the video description. I know I agree it's important that we focus on the best case scenario when it comes to birth. We don't want to spend all our time planning for what if things go wrong. But, in people's birth wishes, their birth plan, we think about if we need a cesarean, if we need a transfer. We also need to put in a section, what if the baby's not very well? So that we can just have these conversations about how we'll make the best of it. How will we feel empowered? How will we set ourselves up to look back and think, I did everything I could to make that easier for us and our baby. I also really want to try and inspire antenatal teachers to talk about NICU and to prioritise talking about it in their discussions with birthing families during pregnancy. 1 in 7 of those people's babies is likely to need special care. So I think we really need to be talking to people about it as part of discussions about birth. I'd also like to share that the charity Bliss has these lovely NICU milestone cards that you can order for free on their website, and they come pretty quickly, so we ordered them and we had them after a few days, and I think that's a lovely thing to have. If I hadn't found out about these, this would be on the list of things I wish I'd known, so I thought I'd include those. I'll put a link as well. And also things like having books that were relevant. If I'd looked at the time, I would have ordered this to read to her in the incubator. So I'll put the link for that too. If you're watching this and your baby's in NICU right now, then I'm sending you so much love and so much peace. And I hope that when your baby comes home, that you can heal from what you've been through. And I hope that you can trust in the journey. That's what I try to do. I try to remember that the universe loves me and life supports me, and there's a reason why we had to go through that. I might not understand it, but I try to trust. So I'm wishing you love. Thank you for watching.